Hi guys, it's Dr. Mayan J, of Forensic Medicine Toxicology faculty from Marrow. I welcome you for the discussion of recall questions of Forensic Medicine Toxicology from NEET-PG 2025, which was recently conducted in August 2025. So when you look at the questions of Forensic Medicine Toxicology, it was moderate level difficulty. Let us look at the topics which are being asked. There was a question on Thanatology. There was a question on traumatology. There was one question on asphyxia. One question from forensic psychiatry, criminal response of insane person, and there were two questions on sexual jurisprudence, and there was one question on toxicology. Normally, we tend to get 3 or 4 questions from toxicology, but this time it was little lesser. So, but you look at the topics, most of the topics are basically frequently asked topics only, but the options were a little trickier. So that is the reason why you should not focus on the previous year questions, but you should focus on previous year topics. We have to have a complete conceptual understanding of the previous year topics. So we can get questions on any of this area from that particular topic. Let us dissect the questions. We'll discuss the questions. To begin with the first questions, according to Protection of Children from Sexual Offences Act 2012, that is POCSO Act, protection against sexual harassment, sexual offences, pornography is provided to dash. It is to all children. Correct answer is all children under 18 years of age, 18 years old. Option A. See, when we discuss about POCSO, this is POCSO, Protection of Children from Sexual Offences Act. You know, the purpose of this act is to protect the children from the offences of sexual assault, sexual harassment, and pornography as well. Now, as per this act, a child is any person less than 18 years of age, irrespective of the gender. This act is gender neutral act, right? So this is regarding a child less than 18 years of age, irrespective of the gender. Maybe a boy, maybe a girl less than 18 years of age, right? This is important because this is in contrast with the other offenses like rape and all, where it happens to be a male specific offense. The males will be the accused, females will be the victim. But this particular offense, this particular act, POCSO, this is gender neutral. It is for both gender, that is both boys and girls less than 18 years of age. So as per this POCSO Act, we have various offences listed under. We can see there is something called penetrative sexual assault. We can say this is penetrative sexual assault. We have sexual assault. We have sexual harassment. We also have child pornography. So these are the various offences which are discussed under this act. So let us have a discussion, quick discussion on this different offences. We need to have the discussion because so this topic may be repeated in the further future examination. So let us see penetrative sexual assault. What is amounting to penetrative sexual assault? Underline the word penetrative. So whenever you say the word penetrative sexual assault, there is an element of penetration. Wherever there is penetration of penis into and vagina, anus, urethra, mouth, or penetration of any object or body part into the vagina, urethra, and anus, or application of mouth to the vagina, anus, urethra of a child, right? That is more important. Of a child, it is amounting to penetrative sexual assault. There is another one that is called sexual assault, wherein with sexual intent, that is more important. With sexual intent, if there is any touching the private parts of a female, if anyone touches the private of a child, right, with or any act which physical contact without penetration, here there is only touching without any sexual penetration at all, or if there is any usage of hormone for the child for early sexual maturity, all this act will be amounting to sexual assault, right? All this act will be amounting to sexual assault. There is another one that is sexual harassment. You see, sexual harassment means any person with sexual intent utters any word or sound or is making a gesture to the child, or if he is exhibiting any object or his body part, or making the child to expose his body part, right, or showing any object to the child for pornographic purpose. Not only that, stalking the child, repeatedly following the child, all this will be amounting to sexual harassment, right? You have to be very clear here. You can notice that if it is sexual, penetrative sexual assault, there will be element of penetration. Whereas if it is sexual assault, there is no element of penetration, there is only touching. The third one, that is sexual harassment, where there is no touching, there is exhibiting any object or showing body parts or showing the pornography to the child, all this will be amounting to sexual harassment. The last one, that is use of child for child pornography, that is the last separate offense. Fine. All these offences will be brought under POCSO Act, right? This was enacted in the year 2012. After that, various amendments have been done. The first offense, penetrative sexual assault, the second offense, sexual assault, can be called as aggravated, provided if it is done by any of this person. Right? The law has given you a long list. So for us to remember this, I'll give you a simple way to remember. You can remember if this offense is done by a person of trust, or if it is done by a relative of the child, or if the age of the child is less than 12 years, right? Or if the child was mentally ill, or if it is done by a two or more accused gang, right? If it is done by two or more person, that is a gang. In all these situations, we can say that it is aggravated. That offense will be aggravated offense. It can either be penetrative sexual assault, aggravated penetrative sexual assault, or it can be sexual assault depending on the act. Right? How can you remember this? You can remember by the mnemonic called treat. Right? You can remember it by the mnemonic called treat. TRAIT. Right? So you can simplify this and you can remember that. Now, you can go further. We can see under POCSO Acts. See, this act is mostly child-friendly. All the mechanisms, everything is meant for child-friendly thing. You can see whenever the person is aware of a crime like this child abuse, you can see that person must be informing to the police. It is compulsory, right? It has to be intimated to the police, and failure to inform the police, it is punishable. It is punishable. You don't have to know the punishment as such. It is 6 months of jail with fine, but you don't have to actually know the punishment. You need to know failure to inform the police, it is a punishable offense. That is why when a doctor comes across this kind of offenses, it is bound duty of a doctor to inform the police. Otherwise, the doctor shall be punished. So when a doctor is examining the child, the doctor should follow this 184 BNSS. Right? The medical examination of the child should be done as per the guidelines laid under 184 Bharatiya Nagarik Suraksha Samhita. So the doctor should be following these guidelines and doctor should examine the child. And remember, whenever we examine the child, the examination should be done in the presence of a parent or any person whom the child is having trust, person of trust. Right? I told you, this entire thing is meant for child-friendly thing. So you can remember the examination should not be done without the presence of this person. The medical examination should be done only in the presence of a parent or any person whom the child is having trust. Remember, whenever you examine a female child, the examination should be done as only by the female medical practitioner. Female or a registered medical practitioner. Remember, as per POCSO Act, if the victim happens to be a female child, the examination should be done by a female doctor. In all such cases, in the court, the trial will be conducted faster, speedy trial will be done. All the cases should be disposed within 1 year as per this POCSO Act. And do also remember, in-camera trial should be done in all these cases. In-camera trial should be done, right? It should be done in a closed court proceedings. That is very important. Not only for POCSO, even for rape cases, it has to be done for closed court proceedings, in camera trial, and the disclosure of the identity of the child should not be done, right? And it will be punishable. Fine. So these are the provisions as per POCSO Act. We have to know this. A 35-year-old assaults his co-worker in office. He was one of the opinion that his co-worker is going to kill him, as heard from voices in his ear. Delusion of persecution. The patient appears disabled with disorganized speech. What is the best course of legal action? Proceed with the routine trial? No. Declare him not guilty due to mentally ill fit. We cannot do that, right? Refer the patient for comprehensive psychiatric evaluation. That is the best thing to be done. We have to evaluate the patient, right? We have to do psychiatric assessment. Based on that, the further course can be decided. Remember, a person may plead mental illness to avoid conviction, because at the time of commission of offense, if the person was mentally ill, the person cannot be punished. You know very well, this is given under section 22 BNS. Or the person may try to avoid the trial itself, because if the person was mentally ill at the time of trial, the person cannot plead. He cannot plead guilty. Or the person may try to say that he was mentally ill and he will try to avoid the capital punishment. There are 3 circumstances for which the person will try to say that he was mentally ill, because he may try to avoid the conviction, he may try to avoid the trial itself, or the person may try to avoid the capital punishment. Right? Remember, but as per law, remember, every person, the law presumes every person is sane person, means mentally sound. Every person is mentally sound unless proved otherwise. Who has to prove that? The burden of proof. When a person says he was mentally ill at the time of an offense, remember the burden of proof or onus of proof, it lies on the accused. Accused should prove that he was innocent. He was mentally ill at the time of an offense. Right? It was the burden of proof, it lies on the accused. Accused should prove. Remember, there are two sections related to that. What are those sections? 367 and 368 BNSS. Bharatiya Nagrik Suraksha Sanhita. 367 and 368 BNSS, this is about procedure of examination of mentally ill person. The magistrate will order for examination of mentally ill person for psychiatric assessment. Based on the outcome, the law will take its course. Right? If the person is mentally ill at the time of commission of offense, the person cannot be convicted. If the person was mentally ill at the time of trial, the person in the trial cannot go on. Right? So based on the outcome, the law will take its course. Remember this section 367 and 368 BNSS. This is about examination procedure. That's why it comes under BNSS. Whereas earlier I told you that is 22 BNS. This is for the unsound person who is not responsible for his crime. Right? Now let's go forward. What is Zasco's phenomenon? This is tendon reflex occurring after death, blood clotting after death, gaping of wound after a stab injury, seepage of blood through the wounds after death. The correct answer is tendon reflex occurring after death of the person, not before death, after death of the person. Let us learn about Zasco's phenomenon, or we can say Zasco's phenomenon. This is a muscle tendon reaction. Whenever you give stimulus, right? Whenever you stimulate the tendon of quadriceps femoris muscle, when you give stimulus for quadriceps femoris muscle, you can see the muscle will contract. You can see the movement of the patella upwards, right? You can see the muscle contraction in the muscle. It is seen even after death of the person, 1 to 2 hours after death. Muscle will be excitable whenever you give a stimulus through the hammer. Right? Remember, this is called Zasco's phenomenon. This is seen. Why it is seen even after death of the person, 1 to 2 hours after death of the person? Because you know there are two types of death. One is called somatic death. One is called somatic death, where the clinical functions are stopped. Stoppage of circulation, stoppage of respiration, stoppage of brain function immediately, just now. Right? The person just now, you say all the clinical functions are stopped. You call this as somatic death. But it does not mean all the cells will be dead in the body at the same time, right? The cells of the body, individual cells will die after few hours. Remember, after some time, that stage we call this as molecular death. First, the clinical functions will stop, then every cell will die. There is a gap. You know, this gap is called a supravital period. This is the period in which the functions would have been stopped. The clinical functions of the organs would have been stopped, but the cells will be alive. The cells will be alive. Cells will be alive. Individual tissues will be alive. This period is a period where you can see this Zasco's phenomenon. And this is the period in which we can harvest the organ. You can also use it for organ harvesting and organ transplantation. Right? This is not the fixed time. The supravital period, it varies from organ to organ, cell to cell, tissue to tissue. It is variable. For certain tissues, it is few minutes itself. For certain tissues, it is a few hours also. Right? It is variable time. For muscle, you can see the muscle getting excitable. Muscle, you can stimulate the muscle. You can see the excitability of the muscle. Right? This is not only seen with quadriceps femoris. You can also sometimes see in the biceps also. Right? So remember, this is Zasco's phenomenon. That is nothing but tendon reflex occurring after death of the person. During autopsy of a 35-year-old female, the doctor noticed bruises below the right mandible. Right? If this is going to be the neck of the person, below the right mandible, you can see some bruises. You can see the bruises with curved scratch on the right side. 3 grouped bruises on the left side of neck. You can see 3 bruises were there on the left side of neck below the thyroid cartilage. Additional bruises were also noted on the head, the shoulder blade, backside of the trunk, left iliac crest, so many places you could see. And internally, you can see fracture of superior horn of thyroid cartilage. What is the likely cause of death? right? You can see from the description itself, from the description of the injury itself, you can come to a diagnosis. You can come to the correct answer, that is throttling. How can we exclude the other options? Right? See, mugging. What is mugging? It is a compression of neck with the bend of elbow or with the forearm. If the person was having the neck compressed by the bend of elbow or forearm, in a case of mugging, the external signs will be very minimal. The external injuries will be very minimal. Minimal injuries will be seen on the neck. Right? Or if at all, you can see some the neck injuries looking like the neck was compressed with a broad surface. Garroting, the neck is compressed with a thin ligature cord, so definitely you should have seen the ligature mark on the neck. Even the ligature strangulation also, if the person neck was compressed with the ligature, you should have found out ligature mark on the neck. Here in the description, there is no mention about any ligature mark on the neck, so the easy answer will be your throttling. One of the most frequently asked question in NEET, even in NEET-PG, right? See, strangulation is where you have compression of neck. There is no body suspension. Had it been body suspension, then we can call it as hanging. Here only it is neck compression. You see, there you can broadly categorize into 5 types depending on the material that we use. If you use a ligature to constrict the neck, that is called ligature strangulation. If you use neck compression with your hand, right? If you are compressing the neck manually by the hands, it is called manual strangulation, also called as throttling. If we use bamboo stick, it is called bandsdola. If it is thin ligature cord from behind, we call this as garroting. And you have the bend of elbow neck compression, we call this as mugging. Right? Now, let us see. Usually, when we get a question on the death due to neck compression, we get questions on 3 important situations. One, they can ask a question on hanging. The other one, they can ask a question on ligature strangulation, or they can ask a question on throttling. These are the primary areas where they focus on. How to find it out? Let us look at the neck findings. Externally, if you will see ligature mark, see in hanging you find ligature mark. In hanging you find ligature mark. Even in ligature strangulation also you find ligature mark. Right? Fine. So, but it is hanging. It can either be oblique, usually oblique, but sometimes it can be transverse also. If it is partial hanging and all, you will find transverse ligature mark. Right? It can be oblique, it can be transverse also. You can see it is incomplete ligature mark and it will be above thyroid cartilage. Had it been ligature strangulation, you will find transverse ligature mark. Usually it is transverse ligature mark. Not only that, it is complete ligature mark all around the neck. Fine. So, if you see this kind of ligature description, you can see there is a case of hanging. In addition to that, you will also be getting questions on findings in the questions like salivary dribbling, law phases sympathetic. All these findings are given in the question. You can say there is a case of hanging. In a case of hanging, internally, you can see soft tissue condition will be there, but not so extensive. Right? You can see the fracture of hyoid bone, that is common. Fracture of cricoid is not common. Ligature strangulation, there will be soft tissue contusion. Remember, you can see the fracture of hyoid bone, it is very, very uncommon. Right? Cricoid is also very uncommon. The skin under the ligature mark, that is very important. The skin under the ligature mark, in a case of hanging, it will be completely pale and it is parchment-like. It is so thick, leathery. Whereas the skin under the ligature mark of ligature strangulation will be having extravasation of blood. Right? You can see contusion under the skin. You can see blood extravasation will be there. That is a classical finding to differentiate a ligature mark of hanging and strangulation. Right? Now we talk about throttling. You talk about throttling, in the neck you can see scratch marks will be there. Not only scratch marks, anteriorly you can see the fingertip bruises will be there. Discoid bruises will be there. We call this as 6 penny bruises. You can either see fingernail scratches, you can also see the 6 penny bruises. If you notice this, then you will see it is a case of throttling. Internally, there will be extensive soft tissue contusion noted. And the most common cause of hyoid bone fracture is throttling only. You will find something called adduction fracture. Whereas in hyoid bone, we get abduction and side to side, but here we get adduction fracture. And this is where you find cricoid cartilage fracture, throttling. right? So in this question, you can notice that in the question that was given, you can notice that the classical description of injuries on the front of neck is given. So this should be case of throttling. So remember the other findings also, which will be helpful for you in the prospectively in the future examination. You know, this is a case of throttling, neck compression. Mugging, I told you, neck compression with bend of elbow or with the forearm. Thin ligature cord from behind, this is called garroting. And you know, Spanish windlass technique, it is a type of garroting. It was a method of judicial execution in Spain earlier, was a method, right? Spanish windlass technique, it is a type of garroting. It's a type of garroting. A patient comes to ER with complaints of pain abdomen, diarrhea, sweating and blood in the stools initially, which later become rice watery. Initially it was bloody, then it became rice watery. Patient also complains of throat pain followed by purging and vomiting. Remember, throat pain followed by purging and vomiting. If you see throat pain, if you see vomiting, purging, remember this is the typical sequence you have to keep in mind. And the vomitus contains bile and blood also. It also has a garlicky odor. That is another keyword. Now, what is the cause? Right? The correct answer for this question is acute arsenic poisoning. We'll discuss why. Why it is acute arsenic poisoning? You remember acute arsenic poisoning, you know, arsenic is a metal irritant. It will have irritant activity. That means it causes inflammation. So the person will be presenting to you with gastroenteritis. Gastroenteritis means inflammation of GIT. The person will be presenting you with loose stools. He will have purging, he will have vomiting, he will have throat pain, everything will be there. That is the reason why we say acute arsenic poisoning, it resembles cholera. Right? It mimics cholera because it has got typical feature just looking like cholera. You can see gastroenteritis. The throat pain, vomiting, purging, if you look at the sequence itself, you can choose that it is acute arsenic poisoning. But sir, why even phosphorus also they may have gastroenteritis? Even aluminum phosphate also, some people will have the gastroenteritic feature. Even croton tizelium, right? The croton tizelium, even that also will be having this diarrhea. Why can't you choose that? Remember, here the person will be having garlic odor, right? Garlic odor is not seen with croton, right? So that option is ruled out. You see, coming to the other one, phosphorus also will have garlic odor, aluminum phosphate also have garlic odor. But remember, if it is acute phosphorus poisoning, remember, you can find what is called as smoky stool syndrome. You can find what is called as smoky stool syndrome. You can see the fumes from the stools. And typically, you must have noticed the luminous vomitus and the stools. Because the white phosphorus, it is luminescent. The white phosphorus luminescent, the vomitus will also be luminescent. The stools will also be luminescent. There is no mention about that in the question. You can exclude that. And aluminum phosphide, which is otherwise called as alphos poisoning or sulfurs poisoning, there is no mention about the systemic toxicity, right? Because, you know, aluminum phosphorus, it liberates phosphine gas, right? It is a systemic poison, phosphine gas. It's a systemic poison. The person will have more of systemic toxicity. CVS will be affected. The respiratory system, lungs will be affected. The person will have acidosis also. Metabolic acidosis will be there. Typically, the person will have hypomagnesemia. So all these features would be seen in alphos poisoning, aluminum phosphorus poisoning. There is no mention about that. And moreover, if it is aluminum phosphorus poisoning, you can diagnose it by what is called a silver nitrate breath test. Right? You can identify with what is called a silver nitrate breath test. The silver nitrate paper will be turning into black color. From that, you can easily find out that it is alphos poisoning. But here, there is no any mention about that. So here, your easy option would be acute arsenic poisoning. You can directly pick the answer even without exclusion. There is no need for exclusion at all. You can directly pick the answer, that is acute arsenic poisoning. The parents of a 16-year-old girl allege kidnapping and rape charges against a 25-year-old man. Remember, the girl is 16, whereas the boy, the male, is 25. The accused says he loves the girl, he wants to marry her, and that the sexual activity was consensual. The girl also agrees that it was consensual. She also agreed that it was consensual. Examination confirms recent sexual activity, but there are no injuries noted. What is a likely legal problem under this Indian law? Right? What is a likely legal issue with the Indian law? Consent is immaterial since the girl is less than 18 years old. That is the correct answer. So what about the remaining options? Option B, no offense since injury is present. That is wrong. Just because the absence of the injury does not confirm that it is not an offense, right? Many times, even it is a sexual activity, rape activity, but still there will not be any injuries because the consent might have been invalid also, or the child might have been frightened, no injuries. Parents should prove that there was an assault or physical resistance. No, it is not the burden of the parent. Burden of proof does not lie on the parent. Normally, in a case of rape and all, the burden of proof lies on the accused, right? It is not the parent should prove. That is wrong option. No offense since the man says he loves a girl, wants to marry her. No, you obviously know that option is also wrong. Here you remember the girl is a 16-year-old girl, minor. So whenever there is, even it is consensual sexual activity, the girl being a minor, this is an invalid consent. So this is an offense, right? So we call this basically as statutory rape. Statutory rape. What is a statutory rape? Sex with a girl less than 18 years. Sex with a girl less than 18 years. With or without consent. With or without consent, that amounts to statutory rape, right? The age is very important. The age is under, the girl is under age, less than 18 years, right? The boy will be punished, right? The age is given, the definition of rape is given under 63 BNS, whereas the punishment of rape is given under 64 BNS. What are the circumstances under which you can say the consent given by the girl is invalid? What are the circumstances under which you can say the consent given by the girl is invalid consent? You can say if the consent given by the girl was given under fear of threat, right? It was given under fear of threat of death of injury. She was threatened and she has given consent. Or if the consent was given because she believes that he is another man whom she is legally married, right? Or you can say it is impersonation. He knows he is not her husband, but she believes that he is another man whom she is legally married. Or the consent was given due to intoxication. If the consent was given due to intoxication, out of intoxication she has given consent, or she was administered some stupefying agent, stupefying drug, she has given consent. You can say date rape, drug and all. Or she has given consent because she was mentally ill, out of mental illness, unsoundness of mind, she has given consent, right? Under all these situations, this consent can be considered invalid. Or if the consent was given by a girl less than 18 years, then you can say that is invalid consent. It is also punishable, it is also an offense when she is unable to communicate consent. When she is unable to communicate consent also, under all these circumstances, that kind of sexual activity will be considered as rape, right? As per 63 BNS. Now look at this question. In the question, there is a mention of the charge of kidnapping and rape as well. Why they have taken a charge of kidnapping? Look at the age of the girl. The age of the girl is 16. Taking away a child less than 18 years from the lawful guardian, it is amounting to the offense of kidnapping. This is discussed under 137 BNS. Remember this section also, it can be expected prospectively, right? Taking away a child less than 18 years from a lawful guardian, that is kidnapping. And the question also mentions that there is examination confirm recent sexual activity. How do you normally confirm that it is recent sexual activity? Maybe when you examine, if you look at the injuries, from the aging of injury you can find out. But in this question, they mention that there are no injuries at all. Then how do you know it is recent sexual activity? When you do microscopic examination of the vaginal swab, if you notice motile spermatozoa, if you're able to see motile spermatozoa, right, that will tell you it is a sign of recent rape. That is important finding for examination, right? Also for MCQ examination as well, it is a sign of recent rape because the motility will be there up to 6 to 12 hours, right? So if you're able to see motile spermatozoa, that will confirm it is a recent sexual activity. So this topic is indeed a very important topic, must know topic. So you can get questions on various aspects of the topic. You need to have a proper understanding of it, right? So most of the questions that we got in the last NEET-PG 2025, all must know topics only, 1 or 2 new questions. So if you had a proper understanding of the subject, you have a proper clarity on the subject, you must have got more than 90% strike rate in your examination. right? So all the very best for the results. Thank you so much.